Welcome, everyone. I'm excited to kick off this presentation on the comprehensive overview of medical oxygen therapy. Today, we'll explore the key principles, clinical applications, delivery systems, and safety considerations involved in this essential aspect of patient care. Over the next few slides, we'll cover everything you need to know to understand how medical oxygen therapy works and how to use it effectively and safely. Let's get started. Welcome to this chapter on medical gas therapy, specifically Chapter 42. Today, we'll be exploring the key aspects of medical oxygen therapy, which is a vital component of respiratory care. Medical gas therapy encompasses the use of gases like oxygen to support or treat patients with breathing difficulties. It's important because oxygen is a life-sustaining element, and understanding how to administer it safely and effectively is crucial for healthcare providers. As we go through this chapter, I'll highlight the most important concepts, connect them to the overall theme of respiratory management, and ensure you grasp how this therapy fits into patient care. So, let's dive into the fundamentals of medical oxygen therapy and its role within medical gas therapy. Let's talk about the vital importance of oxygen. You know, our bodies can survive for days without water and even weeks without food, but without oxygen, things change dramatically. In fact, biological death can begin within just 3 minutes of oxygen deprivation. That's a really striking fact that highlights how critical oxygen is to life. When you can't breathe properly, no other medical intervention really matters as much. It's the foundation of survival. That's why ensuring adequate oxygen therapy is so essential in medical care. Remember, when breathing stops or becomes insufficient, everything else takes a back seat, because oxygen is truly the key to life. Let's take a closer look at oxygen therapy and its key objectives. The primary goal here is to decrease symptoms that come with chronic hypoxemia, which is when your body's tissues aren't getting enough oxygen over a long period. By providing supplemental oxygen, we aim to improve your overall comfort and functioning. Another important aspect is reducing the workload on the cardiopulmonary system. When oxygen levels are low, your heart and lungs have to work much harder to supply enough oxygen to your body. Oxygen therapy helps ease this strain, supporting better heart and lung health. Now, focusing on clinical goals, for chronic hypoxemia, the aim is to correct or at least improve the oxygen deficiency that persists over time. This helps prevent further complications and improves quality of life. Similarly, in cases of acute hypoxemia, where oxygen levels drop suddenly, the goal is to quickly restore adequate oxygenation. It's all about stabilizing your condition and preventing damage. Ultimately, the overarching goal of oxygen therapy is to ensure that your tissues receive enough oxygen to function properly, while also minimizing the stress and workload on your cardiopulmonary system. It's a delicate balance, but one that's crucial for maintaining overall health and well-being. Now, let's talk about assessing a patient's need for oxygen therapy. Certain conditions like postoperative states, carbon monoxide poisoning, shock, pulmonary embolism, trauma, acute myocardial infarction, or even cardiopulmonary arrest often necessitate careful evaluation of oxygen requirements. When we look at clinical disorders associated with hypoxemia, we're typically concerned when the arterial oxygen tension, or PaO2, drops below 55 to 60 Hg, or when arterial oxygen saturation, SaO2, falls under 87 to 90%, especially in patients breathing room air. This threshold helps us identify when a patient might be hypoxemic, but it's also important to recognize the signs that suggest this condition, like rapid breathing or tachypnea, an increased heart rate or tachycardia, bluish discoloration of the skin and mucous membranes, known as cyanosis, and an overall appearance of distress. At the bedside, we need to perform a thorough assessment, especially in patients with the conditions I mentioned earlier, including post-op, co-poisoning, shock, PE, trauma, or during cardiopulmonary arrest. Understanding the patient's clinical condition is vital, as it guides our intervention. We also rely on laboratory findings to inform our decisions. Most importantly, we aim to strike a balance, using strategies that prevent hypoxemia without risking hyperoxemia, which can also be harmful. To sum up, a common and useful threshold for hypoxemia is a PaO2 less than 55 to 60 mHg or SaO2 below 87 to 90%, especially in patients breathing room air. Recognizing these signs early allows us to intervene effectively and tailor oxygen therapy to each patient's needs. Now, let's take a closer look at the clinical signs of hypoxia. When the body doesn't get enough oxygen, it can manifest in various ways that we need to be vigilant about. One of the early signs is disorientation or confusion, which indicates that the brain isn't receiving sufficient oxygen. You might also notice mental confusion, where the patient seems forgetful or unable to concentrate. Restlessness and even somnolence or drowsiness can also occur, showing the body's attempt to respond to low oxygen levels. Behavioral changes are common too, such as agitation or lethargy. Hypertension or elevated blood pressure can sometimes be observed as the body tries to compensate. Skin changes are also key signs. Paleness and cyanosis, which is a bluish discoloration of the skin, especially around the lips and fingertips, signal significant oxygen deficiency. Dyspnea or difficulty breathing is a hallmark symptom, often accompanied by rapid breathing or tachypnea. As the condition worsens, this can be paired with tachycardia, which is an increased heart rate, as the heart works harder to deliver oxygen throughout the body. Recognizing these signs early is crucial in managing hypoxia effectively and ensuring timely intervention. Let's take a look at the clinical practice guidelines related to delivery device contraindications. Some devices, like nasal cannulas, should be used carefully or avoided in certain patients. For example, in pediatric or neonatal patients who have nasal obstruction, using a nasal cannula can be problematic because it might not deliver oxygen effectively and could cause discomfort or other issues. It's important to understand that while many oxygen therapy indications are straightforward, there are some specific contraindications to be aware of, especially regarding the choice of delivery device. However, overall, oxygen therapy is quite safe, and with few exceptions, there aren't many contraindications once the indication for oxygen is established. The key takeaway here is that selecting the right device depends on the patient's condition, and being aware of contraindications helps us ensure safe and effective therapy. This part of the guideline helps us optimize patient care by guiding us on when certain devices should be avoided and emphasizing that oxygen therapy, when indicated, is generally safe to administer. Now, let's discuss some important precautions and hazards associated with oxygen therapy. While oxygen is a vital treatment, it's crucial to understand the potential risks involved. One such risk is absorption atelectasis, which can occur because oxygen can wash out nitrogen from the lungs, leading to alveolar collapse. This highlights why careful monitoring is essential during therapy. Another major concern is the fire hazard. Since oxygen is highly flammable, it can easily ignite if there's any spark or open flame nearby, making safety precautions absolutely vital in clinical settings. For premature infants, there's a specific concern called retinopathy of prematurity. Excessive oxygen can adversely affect the developing retina, potentially causing long-term visual problems. This is why oxygen levels must be carefully controlled in these vulnerable patients. Depression of ventilation is another potential risk. High concentrations of oxygen can suppress the body's natural drive to breathe, which is particularly dangerous for patients with chronic respiratory conditions. Oxygen toxicity and hyperoxic acute lung injury are also significant hazards. Prolonged exposure to high oxygen levels can damage lung tissues, leading to inflammation and impaired gas exchange. Despite these risks, it's important to remember that oxygen is ultimately a life-saving drug. It has the power to save lives in emergencies, but because it is also a potent medication, it must be used thoughtfully, with appropriate precautions to minimize hazards. Balancing the life-saving benefits with these potential risks is key to effective and safe oxygen therapy. Let's discuss oxygen toxicity and acute lung injury related to hyperoxia. First, when excess oxygen accumulates in the alveoli, it causes fluid to build up. This fluid buildup lowers the ventilation-perfusion ratio, leading to shunting and resulting in hypoxemia, or low oxygen levels in the blood. As this process progresses, it damages the type I alveolar cells, which are crucial for gas exchange. Their destruction impairs the alveoli's ability to transfer oxygen efficiently. Initially, exposure to high partial pressure of oxygen, or PO2, damages the capillary endothelium, the thin lining of blood vessels in the lungs. This damage is followed by interstitial edema, which thickens the alveolar capillary membrane. This thickening makes it harder for gases to pass through, further compromising oxygen exchange. Two main factors increase the risk of oxygen toxicity. The higher the PaO2, meaning the partial pressure of oxygen in arterial blood, and the longer the duration of exposure. Both these factors contribute to the extent of lung injury. Now, hyperoxia is typically defined as a PaO2 greater than 300 mmHg. But research shows that clinical effects become more significant when PaO2 exceeds 150 mmHg. So, understanding these thresholds helps us balance oxygen therapy to avoid causing more harm while treating hypoxemia effectively. Let's take a closer look at oxygen toxicity and hyperoxic acute lung injury. First, it's important to understand that supplemental oxygen is essential in many clinical situations. In fact, oxygen should never be withheld from a hypoxemic patient because maintaining adequate oxygenation is critical for survival and tissue health. However, while oxygen is life-saving, administering it at high levels for prolonged periods can cause damage to the lungs. If we can manage a patient's oxygen needs with a lower FiO2, sometimes the lung injury can actually improve or resolve. This highlights the importance of carefully titrating oxygen to the minimum effective dose. Now, as lung injury worsens, blood oxygenation tends to decline, leading to progressive hypoxemia. The tricky part is that if we try to compensate for this hypoxemia by increasing oxygen, we may inadvertently worsen oxygen toxicity. So, it's a delicate balance, providing enough oxygen to keep tissues alive, but not so much that we cause further lung damage. This overall theme reminds us that managing oxygen therapy requires vigilance and precision to prevent additional injury, especially in patients with existing lung damage. Let's talk about oxygen toxicity and acute lung injury now. When we administer supplemental oxygen, especially in cases of hypoxemia, it's crucial to understand the potential risks involved. First and foremost, supplemental O2 should never be withheld from a hypoxemic patient. Ensuring adequate oxygenation is always a priority. However, managing pulmonary damage is a delicate balance. If we can keep the FiO2, that's the fraction of inspired oxygen, at a lower level, sometimes we can actually help the lungs heal. Reducing the oxygen concentration helps minimize further injury, which is a key point to remember. But things can get complicated when hypoxemia worsens. As lung injury progresses, blood oxygen levels tend to drop even more, leading to progressive hypoxemia. If in response, we try to correct this by increasing supplemental oxygen, we risk exacerbating oxygen toxicity. So, while oxygen therapy is essential, we must be cautious to avoid worsening lung damage through excessive oxygen administration. This highlights the importance of careful management, balancing the need to correct hypoxemia with the goal of preventing additional pulmonary injury. Now, I'd like to introduce Dr. John Doe, a renowned pulmonologist, who will share some important insights on oxygen therapy. Dr. Doe emphasizes that careful oxygen management is crucial in clinical settings. While oxygen is essential, he warns about the risks associated with too much oxygen, such as oxygen toxicity or hyperoxic acute lung injury, which can cause further complications. The key takeaway here is that our goal should always be to use the lowest possible FiO2 that still provides adequate tissue oxygenation. This approach helps us balance the benefits of oxygen therapy with the potential risks, ensuring the best outcomes for our patients. Let's talk about depression of ventilation, which is a key consideration in clinical management. The main goal here is to emphasize that using oxygen appropriately is always the priority. We want to avoid hypoxemia, but at the same time, we need to be cautious about how oxygen affects breathing. When we administer moderate to high concentrations of oxygen, there's a small subset of patients, particularly those with COPD and chronic hypercapnia, who might hypoventilate. This phenomenon is known as oxygen-induced hypoventilation. It happens because oxygen can suppress their hypoxic drive, which is normally what stimulates their breathing. So the biggest takeaway is that while oxygen therapy is vital, especially in hypoxemic patients, we must be mindful of this potential side effect. Balancing oxygen delivery to avoid both hypoxemia and hypoventilation is a critical part of our clinical management. It ties into the overall theme of careful, individualized patient care to optimize outcomes. Let's take a closer look at retinopathy of prematurity, or ROP. This is a condition that affects some premature or low birth weight infants who receive supplemental oxygen. It's also known as retrolental fibroplasia, which gives you an idea of how it can impact the eye. The key thing to remember is that ROP is related to the levels of oxygen in the blood. Specifically, if the oxygen levels are too high, they can cause damage to the retina. Excessive blood oxygen levels can lead to scarring of the retina, and this scarring can ultimately cause the retina to detach. As a result, if left unchecked, ROP can lead to blindness. So, how do we minimize the risk of ROP? One important strategy is to carefully control the oxygen levels. The goal is to keep the partial pressure of oxygen, or PaO2, below 80 millimeters of mercury. By doing this, we reduce the likelihood of excessive oxygen exposure that can harm the developing retina. This highlights the importance of balancing oxygen therapy, not just providing enough to support the infant's needs, but avoiding too much that could cause long-term damage. Overall, understanding ROP underscores the critical role of precise oxygen management in neonatal care, which ties into our broader theme of ensuring safe and effective medical oxygen therapy. Now, let's take a look at some of the patients who are at greatest risk during medical oxygen therapy. Specifically, those breathing small tidal volumes are most vulnerable. This includes patients who are sedated, those recovering from surgery with pain, or individuals with central nervous system dysfunction. These factors can impair their ability to breathe effectively, making them more susceptible to complications. Next, it's important to understand what happens when patients breathe in high levels of oxygen. When the oxygen concentration is elevated, it can rapidly deplete the nitrogen in the alveoli, the tiny air sacs in the lungs. This depletion can lead to a collapse of the alveoli, a condition known as lung collapse or atelectasis. This is a significant concern because it can impair gas exchange and overall lung function. This brings us to the risk associated with high oxygen levels, particularly FiO2 levels above 0.5. When the oxygen concentration exceeds this threshold, the risk of absorption atelectasis increases considerably. Essentially, the high oxygen levels can cause alveoli to collapse due to nitrogen washout, which underscores the importance of carefully monitoring oxygen therapy to avoid these complications. In summary, while oxygen therapy is vital, especially in hypoxic patients, it's crucial to be aware of these risks. Patients with small tidal volumes are particularly vulnerable, and high oxygen levels can lead to alveolar collapse, emphasizing the need for balanced and cautious oxygen administration. Now, let's talk about fire hazards during medical oxygen therapy, particularly during certain procedures. When patients are undergoing surgery or procedures like tracheotomies, or when electronic scalpels or cauterizing devices are in use, the risk of fire becomes a critical concern. These devices can generate heat or sparks, and when combined with oxygen, the potential for fire increases significantly. It's especially important to remember that higher FiO2 levels, meaning the higher the concentration of oxygen in the air the patient breathes, can elevate this fire risk even further. The more oxygen present, the more combustible the environment becomes, making safety precautions absolutely essential. This connects to our overall theme of ensuring safe and effective oxygen therapy. We need to be vigilant during procedures, especially when high oxygen levels and surgical tools are involved, to prevent any fire hazards. Always coordinate closely with the surgical and anesthesia teams to minimize these risks and ensure everyone's safety. Today, we're going to take a closer look at oxygen delivery systems, focusing on their different designs and how they perform clinically. This is important because the choice of system can really impact patient care and oxygen therapy effectiveness. When we talk about clinical performance, we're really asking two key questions. First, how much oxygen can the system deliver? And second, does the FiO2, the fraction of inspired oxygen, stay consistent or change as the patient's breathing demands fluctuate? These factors are crucial in ensuring that patients receive the right amount of oxygen throughout their treatment. Now, there are three basic designs of oxygen delivery systems we need to understand. The first is low-flow systems, which deliver oxygen at a rate that may not meet the total inspiratory flow of the patient, often resulting in a variable FiO2. Next, we have reservoir systems, which store oxygen and provide higher concentrations, making them more efficient in certain situations. Lastly, high-flow systems are capable of delivering a precise and consistent flow of oxygen, which is especially useful for patients with higher oxygen demands or irregular breathing patterns. To sum up, understanding these basic designs helps us tailor oxygen therapy to each patient's specific needs, ensuring safety and effectiveness. Remember, the choice of system directly impacts how well the therapy is delivered and how the patient responds, which ties back into our overall goal of optimizing oxygen delivery for better patient outcomes. Oxygen delivery systems are absolutely crucial when it comes to providing supplemental oxygen to patients who have respiratory conditions. These systems include various devices like nasal cannulas, face masks, and oxygen concentrators, each designed to meet different clinical needs. Let's start with nasal cannulas. They are lightweight and comfortable, which makes them ideal for patients who need oxygen over an extended period. Because they're easy to wear and allow for mobility, patients can go about their daily activities while receiving the oxygen they need. Next, we have face masks. These are used when higher concentrations of oxygen are necessary, particularly in acute care settings. They fit over the nose and mouth, ensuring a more controlled and higher flow of oxygen, which is vital in more severe cases. Finally, oxygen concentrators are interesting devices. They work by extracting oxygen from the surrounding air and delivering it directly to the patient. This makes them quite convenient, especially for long-term oxygen therapy, because they don't require oxygen tanks and can be used at home. Overall, understanding these different oxygen delivery systems helps us tailor treatment to each patient's specific needs, ensuring they receive the right amount of oxygen in the most comfortable and effective way possible. Now, let's take a closer look at low-flow systems, specifically the nasal cannula. One important concept to understand here is FiO2 dependency. Essentially, the FiO2, or the fraction of inspired oxygen, depends on how much room air the patient inhales along with the oxygen. So, if the patient breathes in more room air, the delivered oxygen concentration decreases. Next, humidity plays a role too. When the input flow exceeds 4 liters per minute, we usually add a humidifier. This helps prevent dryness and maintains mucosal integrity, making the therapy more comfortable and effective. Regarding flow rate specifications, nasal cannulas are typically used with flow rates ranging from about 0.25 to 6 liters per minute. For adults, the common range is between 1 and 6 liters per minute, while for infants, it's usually less than or equal to 2 liters per minute. As for the FiO2 delivery range, nasal cannulas can deliver oxygen concentrations roughly between 24% and 40%. In some cases, it can go up to around 44%, depending on the flow rate and the patient's breathing pattern. It's also worth noting that the nasal cannula is the most widely used device for oxygen delivery, thanks to its simplicity and comfort. Finally, I want to mention that today we're focusing on the standard low-flow nasal cannula, so we won't be covering the high-flow versions in this discussion, as those will be discussed later. Now let's take a closer look at the nasal cannula, a common medical device used to deliver supplemental oxygen or increased airflow to patients who need respiratory support. Essentially, it's a lightweight tube with two small prongs that are gently inserted into the patient's nostrils. Its design makes it comfortable and practical for both short-term and long-term use. You'll find nasal cannulas in a variety of settings, including hospitals, clinics, and even in home care situations, which highlights their versatility. They come in different sizes and flow rates, so healthcare providers can tailor the oxygen delivery to meet each patient's specific needs. Typically, they're used for patients with chronic respiratory conditions, during surgeries, or in emergency situations where quick oxygen support is essential. Overall, the nasal cannula is a simple yet effective device that plays a crucial role in respiratory therapy, aligning perfectly with our broader focus on safe and efficient oxygen delivery methods. Now, let's look at how we can estimate the FiO2 based on the liter flow. As you can see, at a flow rate of 5 liters per minute, the FiO2 is approximately 0.4. This means that with higher flow rates, the patient is receiving a higher concentration of oxygen. When we decrease the flow to 4 liters per minute, the FiO2 drops slightly to around 0.36. At 3 liters per minute, it's roughly 0.32, and at 2 liters per minute, about 0.24. Finally, at 1 liter per minute, the FiO2 is lower, around 0.24 as well. This pattern shows us that as we increase the flow rate, the inspired oxygen concentration also increases. Conversely, lower flow rates tend to deliver a lower FiO2. It's important to keep these estimates in mind when adjusting oxygen therapy, especially in situations where precise oxygen delivery is critical. This table helps us understand the approximate FiO2 we're providing at different flow settings, which is essential for tailoring therapy to each patient's needs. Let's take a look at low-flow systems, starting with the nasal catheter. These systems are designed to deliver oxygen at relatively low flow rates, typically between 0.25 and 5 liters per minute. While they were once more common, you'll find that they're rarely used today, mainly because there are more advanced options available. One important aspect to keep in mind is placement. If the catheter is inserted too deeply into the nostrils, it can cause discomfort or even trigger gagging or swallowing of gas, which isn't ideal. So, proper placement is key to ensure patient comfort and safety. In terms of oxygen delivery, nasal catheters can provide a fraction of inspired oxygen, or FiO2, ranging from about 0.22 up to 0.45. That means the oxygen concentration delivered can vary quite a bit, depending on the flow rate and the patient's breathing pattern. As for their purpose, nasal catheters are generally used for short-term oxygen therapy, especially during specific procedures where a precise or higher concentration isn't necessary. They're suitable for flows within that 0.25 to 5 liters per minute range, making them useful in certain clinical situations, but limited in their application compared to other delivery systems. Now, let's look at transtracheal catheter oxygen therapy, which is a specialized method of delivering oxygen directly into the trachea. One thing to keep in mind is that this approach can have some complications, such as infection or mucus plugging, so careful monitoring is essential. It's important to emphasize that proper maintenance and regular cleaning of the catheter are crucial to prevent these issues. In terms of how it works, this method delivers a fractional inspired oxygen concentration, or FiO2, typically between 0.22 and 0.35. This range allows for efficient oxygen delivery while minimizing the risk of dryness or irritation. Speaking of delivery, the flow rates used with a transtracheal catheter usually range from about 0.25 to 4 liters per minute, giving us flexibility based on the patient's needs. Now, regarding placement and design, the catheter is surgically placed and made of thin Teflon material. It's inserted directly into the trachea through a small opening in the neck, which makes it a more permanent solution. To keep it secure and prevent movement, it's often held in place with a chain necklace. Overall, while transtracheal oxygen therapy can be very effective, it requires careful attention to maintenance and proper placement to ensure safety and optimal oxygenation. This method fits into our broader theme of personalized respiratory support, offering targeted oxygen delivery for suitable patients. Today, I want to talk about transtracheal oxygen therapy, which involves using a small, flexible catheter that's inserted directly into the trachea to deliver oxygen. This approach essentially bypasses the upper airways, making oxygen delivery more efficient. It's particularly useful for patients who need long-term oxygen therapy and may have difficulty with traditional methods like nasal cannulas or masks. The benefits are quite significant. Patients often experience better oxygenation, require less oxygen flow, and enjoy increased mobility. However, we also need to be aware of potential risks, such as infection, catheter displacement, and irritation of the trachea. Overall, transtracheal oxygen therapy offers a targeted and effective option for certain patients, fitting well into our broader discussion on optimizing oxygen delivery methods. Now, let's take a closer look at the performance characteristics of medical oxygen therapy, specifically focusing on the factors that influence air dilution. The amount of air dilution that occurs during oxygen delivery actually depends on several patient and equipment variables. These variables play a critical role in determining the actual oxygen concentration the patient receives. For example, when using a low-flow system, the oxygen concentration delivered can vary significantly because it's affected by how much air mixes in with the oxygen. This variation is important to understand because it impacts how we assess and adjust oxygen therapy for each individual patient. So, the key takeaway here is that oxygen concentration isn't always constant. It can fluctuate depending on these factors. Recognizing this variability helps us ensure that we're providing safe, effective oxygen therapy tailored to each patient's needs. And this connects back to the overall theme. Understanding how different variables influence oxygen delivery allows us to optimize patient care effectively. Now, let's talk about the variables that affect the FiO2 in low-flow oxygen systems. This is an important aspect because it helps us understand how to optimize oxygen delivery based on patient needs. One of the main factors is the patient's breathing pattern, including their tidal volume and respiratory rate. These can significantly influence the actual amount of oxygen the patient receives. Additionally, the flow rate of oxygen we set on the device plays a crucial role. If the flow rate is too low, the patient might be drawing in more room air, which can lower the FiO2. Conversely, higher flow rates tend to deliver a more consistent oxygen concentration. Another key point is the fit and positioning of the nasal cannula or mask. An improper fit can cause oxygen to leak, which again affects the FiO2 delivered. Finally, it's important to remember that these variables are interconnected. Understanding and managing them helps us ensure our patients receive the appropriate oxygen therapy, aligning with the overall goal of providing safe and effective respiratory support. Now, let's talk about troubleshooting low-flow systems. One common issue we might encounter is skin irritation. This can happen when the delivery system is in contact with the skin for too long or if the fit isn't quite right. It's important to monitor the patient and make adjustments to prevent discomfort or skin breakdown. Another frequent problem is device displacement. Since these systems are often on the move, the device can shift out of position, which can compromise oxygen delivery. Regular checks are essential to ensure everything stays properly aligned and functioning as it should. We also need to be aware of system leaks and obstructions. Leaks can occur if connections aren't secure, leading to less effective oxygen delivery, while obstructions in the tubing can reduce flow altogether. Listening for hissing sounds or inspecting the system regularly can help catch these issues early. Lastly, inaccurate flow is another challenge. Sometimes the flow rate may not be precise due to calibration issues or other malfunctions. This can impact the patient's oxygen levels, so always verify the flow settings and ensure the equipment is properly calibrated. By understanding and addressing these common problems, we can ensure the oxygen therapy remains effective and safe for our patients. Now, let's take a closer look at reservoir systems. These tend to provide a higher FiO2 compared to low-flow systems, which makes them particularly useful when we need higher oxygen concentrations. During periods of high inspiratory flow, patients will draw from this reserve supply whenever their inspiratory demand exceeds the oxygen flow being delivered by the device. Essentially, the reservoir acts as a backup, ensuring that the patient maintains adequate oxygen levels even during deeper or faster breaths. The mechanism behind these systems involves gathering and storing oxygen between breaths, so when the patient inhales more vigorously, they can draw from this stored supply. This design helps optimize oxygen delivery and ensures a more consistent and reliable oxygenation, which is especially important in patients with increased inspiratory needs. Connecting this to our overall goal, reservoir systems are a valuable tool for providing efficient and effective oxygen therapy tailored to the patient's breathing pattern. Let's take a closer look at reservoir systems, specifically cannulas, and their role in medical oxygen therapy. One key point to remember is that humidification is generally not necessary with these systems. In fact, adding moisture can actually interfere with the performance of the reservoir membrane, so it's best to avoid excess moisture. These systems typically deliver an FiO2 range from about 22% to 35%, depending on the flow rate and system used. They are usually employed with flow rates between 0.25 and 4 liters per minute. Now, there are different types of reservoir systems designed to conserve oxygen, which is especially important for patients who need long-term therapy. For example, the oximizer, nasal reservoir, and pendant reservoir are all designed with this goal in mind. They can significantly reduce oxygen consumption by as much as 50 to 75%, making therapy more efficient and cost-effective. When considering humidification, the main takeaway is that it's typically unnecessary for these reservoir systems, but always check specific patient needs. The different brands and models vary in flow rates and the FiO2 they provide, but the core purpose remains the same: to deliver oxygen efficiently while conserving resources. Overall, these reservoir systems are a vital part of oxygen therapy, helping ensure patients receive the necessary oxygen while minimizing waste. Cannulas are an essential part of reservoir systems. They play a crucial role in delivering fluids or medications directly into the body, making treatments more effective. You'll find that cannulas come in various sizes and designs, tailored to different medical needs and applications. The design focus is on ensuring minimal discomfort for the patient while still providing efficient and reliable fluid delivery. These reservoir systems with cannulas are widely used across hospitals and clinics, highlighting their importance in everyday medical care. Overall, understanding how cannulas function within reservoir systems helps us appreciate their vital role in delivering safe and effective treatment. Now let's take a closer look at reservoir systems, specifically masks, and their role in oxygen therapy. The main purpose of reservoir masks is to deliver oxygen efficiently to patients, ensuring they get the right amount of oxygen quickly and effectively. When we talk about masks, there are 3 primary types we need to be familiar with: the simple mask, the partial rebreathing mask, and the non-rebreathing mask. Each of these serves a different purpose and provides varying levels of oxygen concentration depending on the patient's needs. Introduction to masks is important because they are actually the most commonly used reservoir systems in clinical practice. They are versatile, relatively easy to use, and critical in managing patients with different oxygen requirements. Understanding the differences among these masks helps us choose the right one for each situation, ultimately improving patient outcomes and ensuring efficient oxygen delivery throughout the care process. Let's take a closer look at the simple mask. One important aspect to understand is that air dilution can easily occur during inspiration through its ports and around its body. This means that the oxygen delivered isn't always at a fixed concentration. As a result, the simple mask provides a variable FiO2, typically ranging from 0.35 to 0.5. Now, the FiO2, or the fraction of inspired oxygen, depends on several factors. For example, the input flow rate plays a significant role. The recommended input flow for an adult using a simple mask is between 5 and 10 liters per minute. It's crucial to note that if the flow drops below 5 liters per minute, the mask can act as dead space, leading to rebreathing of CO2, which isn't ideal for the patient. Also, the actual FiO2 delivered can vary based on a few other factors. These include the mask volume, how much air leaks around the mask, and the patient's breathing pattern. All of these influence the overall oxygen concentration the patient actually receives. So, understanding these factors helps us optimize oxygen therapy with a simple mask and ensure our patients are getting the most effective care. Let's take a closer look at the simple mask and some of its key considerations. When using a simple mask, one important factor to keep in mind is the dead space concern. Specifically, if the oxygen flow is less than 5 liters per minute, the volume of the mask itself can act as dead space. This means that some of the exhaled CO2 can be rebreathed, which isn't ideal for patient care. Now, moving on to what affects the FiO2, or the fraction of inspired oxygen. FiO2 isn't fixed. It varies depending on several factors. These include the oxygen input flow rate, the volume of the mask, any air leaks around the mask, and even how the patient is breathing, whether they breathe shallowly or deeply. All of these elements influence how much oxygen the patient actually receives. Next, let's talk about air dilution. During inspiration, air can easily dilute the oxygen because of the ports on the mask and the space around the mask's body. This means the FiO2 can fluctuate, providing a variable oxygen concentration rather than a precise amount. Regarding the FiO2 range, it typically falls between 0.35 and 0.5. So, patients are generally receiving between 35% and 50% oxygen with this device. Finally, considering the input flow range for an adult using a simple mask, it's usually between 5 and 10 liters per minute. When the flow drops below 5 liters per minute, the mask volume again becomes a concern because it acts as dead space, leading to potential CO2 rebreathing. Understanding these points helps us optimize oxygen delivery and ensure we're providing safe and effective therapy. Now, let's take a closer look at the comprehensive overview of medical oxygen therapy, focusing on the devices that cover the nose and mouth. These are primarily used for basic protection against droplets, which is especially important in preventing the spread of infections. When we compare the simple mask and the aerosol mask, we see some key differences. The simple mask is mainly designed for delivering aerosolized medications and is used in medical treatments that require inhalation therapy. It's straightforward and effective for delivering certain types of medication directly to the lungs. On the other hand, the aerosol mask is more specialized. It's used to deliver aerosolized medications more efficiently, often in situations where precise delivery is crucial. Both masks are essential tools in our respiratory care arsenal, but understanding their specific purposes helps us choose the right device for each patient's needs. This knowledge ties back to the overall theme of ensuring safe and effective oxygen therapy, minimizing risks while maximizing therapeutic benefits. Let's take a closer look at the rebreathing masks, which share a similar design. Each of these masks features a 1-liter flexible reservoir bag attached to the oxygen inlet. This bag plays a crucial role because it increases the reservoir volume, allowing the patient to re-inhale some of the exhaled gases. As a result, both masks can deliver higher FiO2 capabilities compared to a simple mask, making them more effective for patients needing higher oxygen concentrations. Now, the key difference between these designs comes down to the use of valves. The presence and placement of valves determine how much of the exhaled air is rebreathed versus vented out. This subtle but important difference influences the efficiency and the oxygen delivery level of each mask. So, in essence, while the basic design is similar, the use of valves is what sets these rebreathing masks apart and impacts their overall performance in oxygen therapy. Now, let's take a closer look at the partial rebreathing mask. During inspiration, oxygen from the source flows directly into the mask and then to the patient. A key feature of this mask is that it does not have any one-way valves, which means the exhaled air isn't completely expelled out but partly rebreathable. For an adult using this mask, the input flow should be at least 10 liters per minute. This minimum flow is important to prevent the bag from collapsing during inspiration, ensuring a steady supply of oxygen. The FiO2, or the fraction of inspired oxygen, can range from about 40% up to 70%, depending on the flow rate and the patient's needs. Now, when the patient exhales, the source oxygen enters the bag again, which helps mix the exhaled air with fresh oxygen. This process allows the patient to rebreathe some of their exhaled gases, making it efficient for certain clinical situations. So, in summary, the partial rebreathing mask is a simple yet effective device that relies on a specific flow rate and the absence of one-way valves, ultimately allowing for controlled oxygen delivery while conserving oxygen when appropriate. Let's take a closer look at the non-rebreathing mask, which is an important tool in oxygen therapy. Its main purpose is to prevent rebreathing of exhaled air and to ensure that the patient receives an adequate amount of oxygen. This is crucial for patients with significant oxygen needs. The FiO2, or fraction of inspired oxygen, that this mask can deliver ranges from about 0.6 up to 0.8. That means it can provide a fairly high concentration of oxygen, which is often necessary in more critical cases. In terms of input flow, for an adult using a partial rebreathing mask, you want to set the flow to at least 10 liters per minute. This helps prevent the bag from collapsing during inspiration, ensuring the patient always has a steady supply of oxygen. One key feature of the non-rebreathing mask is the presence of one-way valves, either 2 or 3, that prevent the patient from rebreathing their own exhaled air. These valves are what make the mask effective in delivering high concentrations of oxygen. And finally, you'll find that the non-rebreathing mask is more commonly used than the partial rebreathing mask because of its ability to deliver higher oxygen concentrations reliably. It's a vital device in many emergency and critical care settings. Now, let's take a closer look at the non-rebreathing mask, a vital device used in medical settings to deliver high concentrations of oxygen. It consists of a face mask connected to a reservoir bag, which stores oxygen, and it has one-way valves that play a crucial role. These valves ensure that when the patient exhales, the exhaled air doesn't flow back into the reservoir bag, but is directed away. This setup guarantees that the patient inhales mostly pure oxygen, without rebreathing their own exhaled air. Non-rebreathing masks are especially important in emergency situations or for patients experiencing severe respiratory distress, where maximizing oxygen delivery is critical. They are designed to provide oxygen concentrations of up to 100%, making them a powerful tool in managing urgent respiratory needs. Overall, understanding how this device works helps us appreciate its role in delivering effective oxygen therapy when every second counts. Now, let's look at some common troubleshooting issues with reservoir systems. One of the first concerns is claustrophobia. Some patients may feel uncomfortable or anxious because of the mask's fit, so it's important to monitor their comfort and consider alternative options if needed. Another issue we often encounter is skin irritation. The mask can sometimes cause soreness or redness on the skin, especially if worn for long periods. Regular skin checks and proper mask fitting can help minimize this problem. Inadequate flow is another challenge. If the oxygen delivery isn't sufficient, patients may not receive the therapy they need. Ensuring the system is set up correctly and checking for any blockages can resolve this. System leaks and obstructions also pose problems. Leaks can reduce the amount of oxygen delivered, while obstructions can stop the flow altogether. Regular inspection and maintenance of the system are key to preventing these issues. Lastly, device displacement is common, especially if the mask shifts out of place during movement. Securing the mask properly and educating patients on adjustments can help maintain effective oxygen delivery. Remember, addressing these issues promptly helps ensure that the therapy remains effective and comfortable for the patient. This comprehensive understanding ties back into our overall goal of providing safe, efficient, and patient-centered oxygen therapy.